New at 5, keeping safe from COVID-19 obviously is a challenge, but the stakes are even higher if you're diabetic. That's because people with diabetes who get COVID-19 are at a greater risk of becoming hospitalized and perhaps even dying.
ABC 3340 Cynthia Gould explains that means effectively managing diabetes is more important than ever.
Hasa Kingo is one of 34 million Americans with diabetes. He's had trouble managing it during the pandemic.
That was a really uncertain and challenging thing for me because I was so used to the process of going to see my endocrinologist every few weeks and months to manage my diabetes.
While diabetics are no more likely to get COVID-19, they are far more likely to have severe complications.
Any infection, you're going to be at higher risk.
Dr. Erin Townsley says uncontrolled diabetes, a consistent elevated blood sugar, is of most concern, especially in those with type 2 diabetes, which affects older people and those who are obese. Many doctors are offering telemedicine visits, but often in person is needed.
And that's really so your doctor can see you face to face, do a thorough physical exam. And what they're looking for in the physical exam, they're listening to your heart and lungs, but they're also looking at your feet to be sure that you don't have any infection in your feet.
Keeping close tabs on your diet is also crucial.
Also really monitoring what you're eating, particularly processed sugar, carbohydrates, and limiting the calories. So that's really important. It's easy when you're bored sitting at home to just snack on things.
She urges caution with COVID, but remember,
if you're seeing your doctor regularly and you're well controlled and you're taking care of yourself, just having that diagnosis of diabetes is not a death sentence. So most people that get COVID are going to be okay.
Other advice, consider setting up regular delivery of medicines and supplies. The same for groceries to keep fresh foods on hand. And be sure to keep your scheduled medical appointments. Find ways to stay active and exercise, from online programs to walks in the neighborhood. Stick with something that works for you. Cynthia Gould, ABC 3340 News.
And researchers are also looking into cases where COVID patients have spontaneously developed diabetes. It's speculated COVID may damage insulin-producing cells, triggering an onset of diabetes.